Hey guys, welcome to Belly Strong. Today we'll be discussing hip pain, which is a common one during pregnancy. And this happens because of a few things. So what you get during pregnancy is the releasing of a hormone called relaxin. And this ends up relaxing or loosening a lot of the ligaments around the hips and the pelvis. You also get reduced tension or a loosening of the stabilizing muscles surrounding the hips, like the glutes. And both of these combined lead to less stability around the pelvis and hips, which means that your pelvis and your hips are less able to deal with normal load, and this can cause pain. So the key things that you want to address when you have hip pain are mobilizing or introducing movement into the joints around the pelvis and the hips. You want to loosen up any muscles that might be too tight or spasming. And the key thing that you really want to do over a few weeks is increase your hip strength. And we're going to go through a few release movements in this video to loosen up the joints and the muscles around the hip. And in our next video, we'll cover some key strength exercises to get your hip pain moving along. So the first release is a tennis ball release into the glute. So what you'll need is a tennis ball or a ball that's maybe slightly larger and harder. You're going to place it into the middle of the buttock. Put pressure onto that hip and you're just rolling around on the ball, trying to find any areas that might feel tense or tight or a little bit more tender. And you're rolling over those or massaging those out. Once you've done the main part of the buttock for 30 seconds to a minute, you're then going to move the ball into the meaty side of hip area. And if you find your hip bone, it's quite hard, you're going to put the ball just above the hip bone on the side of the hip. Turn onto your side, knees slightly bent, and you're pushing or massaging into those muscles on the side of the hip. These can often be really, really tender. You might feel pain referring or shooting down to the side of your leg or calf, and that's when you'll know you found a trigger point or something that needs to be released. And you can rock back and forth on any tender point you find, and just roll around, releasing all of the tender and tight spots that you find for about a minute to start with. And if there are no adverse reactions, you can do it for a little bit longer. Once you've released the tight muscles, we'll stretch them out. And the first stretch is a figure 4 stretch. So you'll sit back, supporting yourself on your hands, cross one leg over the other, and sit up, push that chest out as you bring the leg closer to you and trying to open that knee out. This can also be done in a sitting position. And what you want to do is hold this for maybe 15 to 20 seconds, release, and then do it again. And this is really stretching out some of the big muscles around the hip region. The last exercise focuses on introducing movement into the hips, pelvis, and lower spine. You will lie on your back. You'll come again into that figure 4 position, and this time you're dropping the knee, so the foot that is on the mat, you're dropping that knee over and across the body. So dropping your knees towards the leg that is up. You can move your hand out of the way. And you should feel a bit of a stretch here. You want to keep a little bit of tension in those abdominals as you come back up. But you drop down and you can come back up. The further out your foot is to the side and the closer towards you, the more you'll feel a stretch in this region. Here. So just remember to drop the legs to the side of the leg that is crossed over. And you can do 8 to 10 of these and hold the last one for 15 to 20 seconds. So those are a few quick mobilizations or releases that you can do. In our next video, we'll cover a few strength exercises that you can start with to ultimately increase stability around your hip and pelvic region. I'll see you soon on another video. Bye guys.